another rainy evening. I'm so excited to talk to you guys about functional medicine, to explain why we so badly need this approach to help not only ourselves, our children, our families, but also actually the country, the NHS. There's lots of reasons why I'm so passionate about functional medicine, and I'm going to hopefully lead you through them, and I'm going to talk to you a bit about what it entails. Just come and see me and what we look at. So as Joe mentioned, I'm actually a medical doctor. I trained at the Royal Free Medical School, and then went on to be a psychiatrist. And during that time, I had a mixed experience in terms of whether I felt I was really helping my patients. Being able to talk with them and do psychological therapies was incredibly rewarding for myself, and I hope the patients as well who saw me. But some of the other aspects of the treatments I had available to me, I found difficulty with. I had questioned whether or not I was really helping people. I had a break and time away due to the illness of my father, and during that time delved deeper into my passion around nutrition and understanding how to help people be well and restore the normal functioning of their body. I also have another hat that Joe mentioned. I'm also the chair of the Down Syndrome Research Foundation, so you might wonder why. And this young man is why. He is my brother. He is the youngest of 6. His name is David, and he is allowed to have a drink. He is in his 30s. So when David was born, it was back when people thought there was nothing you can do to help someone with Down syndrome. It's an extra chromosome. Everything's written in stone. You can't change someone's DNA and their genes. And my dad, being an engineer, felt, actually, no, I don't quite believe that. I just don't see how that's how humans have survived as long as we have. So he delved into the research and actually discovered there wasn't much going on. So he set up the charity over 20 years ago. And through the course of my childhood and growing up, and then choosing what I wanted to do, I did what lots of siblings of people with special needs did. I went into a caring profession, healthcare, so I decided to apply to medical school. And medical school, obviously, as you can imagine, is incredibly involved. Lots of learning and memorization and hard work, and then you hit the wards. And what I discovered during the course of my early medical career was all that anatomy and physiology we learned that goes awry, we didn't learn how to fix it and how to get it back to what it should be doing normally. We learned a number of other different interventions that it sort of didn't quite fit for me. I felt there was something missing. I had a passion for psychiatry and finding out why people make the choices they do and the things they do, and so then I pursued my career in psychiatry. And then through the course of sort of my own illness, and as I mentioned, my dad's illness, I delved more into learning about functional medicine. So to introduce Abir. So I don't know if you want to stand up and introduce yourself, or
shall I?
Yeah, come on up.
Okay. Do you want to come up? So, okay, fine. Hi, so yeah, it's really nice to be here tonight speaking with Liz. I know I've met a couple of you before in consultations. So I'm a nutritional therapist, and actually, interestingly, went right into, with my training in a whole body approach, so looking at someone not just for the symptoms that they came in with, but also just looking at the nutrition and the lifestyle reasons behind why they might be suffering with the symptoms that they were. And for various different reasons, I think I got into working with Joe, and it was quite a long time ago, and so since then, maybe 7-8 years, I had a little break in the States. I've been working with children who have learning and developmental issues, and looking at their health as a whole, very much looking at their nutrition and their gut health, and trying to optimize that, because in the way that we were trained, gut health and nutrition plays a huge role in mental health and vitality, really. And so I have over 10 years experience of working in nutritional therapy, and I am also a director on the board of the British Association for Nutrition and Lifestyle Medicine, and through our association we really try and promote the benefits of nutrition and lifestyle. So they come together. It's not just nutrition, it's lifestyle, and this is the umbrella of functional medicine. And so very much working with patients individually to optimise their health through both those things. Yeah, and I'm really looking forward to speaking with this.
Okay, so you're going to see Abir again in a moment. So what I'm going to do is I'm going to lead you through an understanding of why we need functional medicine really as a whole, and what are the differences between different types of health conditions. So maybe many of you have heard the term acute and chronic, but maybe aren't so sure what it means and actually why we kind of need a different approach for these two types of issues. So an acute issue is, as you see in the picture, something like a broken bone, a cold. It's something that can come on over a short duration, and often it's most like infections that you have. We can probably most of the time restore you to your full health through setting the bone, treating the infection, or if it's a virus, letting it run its course and supporting the body. It's time limited. So on the other side is chronic illness. So we can see them lasting a year or more, sometimes lifelong. The symptoms build up slowly, and we can sort of begin to think, maybe I'm going to get this condition. Maybe we go to see the GP, but we don't yet have the necessary numbers on our blood test to come over to the point at which we diagnose with that condition, but we feel that we're potentially leading that way. And it is affected, we know now, based on lots and lots of research, by lifestyle choices. Not only, just lifestyle choices, other factors can play into them, but lifestyle choices are a huge part of why we might develop a chronic illness. And unfortunately, leading cause of death worldwide. So when a little while ago, the King's Fund, which is a think tank that was set up to analyze what we understand about what is the challenges for caring for people in the NHS, what are the things that the NHS needs to change and what needs to keep, what's working and what isn't, and really to understand clearly what the problems are. One of the big things was issues around chronic illness. So in 2012, there's 50 million people in England with a long-term condition, and they project by 2025 that's going to go up to 18 million people. In the States, it's 1 in 10 people have a chronic illness, and 4 in 10 adults have 2 or more. And just to give you an idea of maybe the money that we put towards caring for this, it's £7 out of every £10 of health and social care spending goes towards looking after people with chronic illness. So it's important to understand that it's a big problem also in children as well. So in looking at teenage prediabetes and diabetes, we know from 2000 to 2008 went from 9% up to 23%. So it would be reasonable to believe that it actually has climbed further since that point. The other thing to understand as well is the fact that 30% of these people also have mental health problems, and that there's a big interplay between mental health problems and physical health problems. And they, from my understanding of the research, they actually make the other worse. So if you have a mental health problem, your physical health difficulties are going to be exaggerated or increased, unfortunately. What do we know about population lifestyles and the risks that they present to health? So at the time of doing this research, they found that 70% of the adult population in the UK are inactive, 21% smoke, 26% are obese, and you can see the split with drinking too much between male and female. 70% don't eat the recommended amount of fruit and vegetables. I don't know, I'd probably say it was probably worse than that, because that would have been based on government recommendations, which I would argue are slightly, lower than what they need to be actually for health. So, what was their recommendations? What do they tell the NHS that needs to happen? And I've highlighted some of these things here. So things need to change. It needs to become more integrated between the people who are needing this help and the actual people who are delivering the care. It shouldn't be about the fact we can fit a hospital and lots of people are in that hospital. It doesn't matter that everyone has to drive miles and miles. It actually should be based around you and the people who need the care. And there needs to be a huge, strong focus on prevention. So what is the way we practice medicine now? How is that different? So what happens now is this is the top of a tree, and I'm going to show you the rest of the tree in a minute. You present here with your signs and your symptoms, your rash, or your, your cough that won't go away, or your IBS. And what your doctor does, your GP, or whoever you present to, is they look at your symptoms and they begin to try to understand what organ system specialist you might need to see. So if you've got a skin issue, they're going to send you to dermatology and any of these specialities. And it's been a useful approach because it's meant that the doctors in these specialities become experts in those conditions. But the problem is that that's not the way the human body behaves. That there's often, you might have more than one of these symptoms crossing these different organ systems. And the doctors have sometimes a problem with talking to each other and sharing knowledge and understanding what is going on. I treated that problem, but then this one appeared. I'm just going to send you to a different doctor to deal with that. And it has been useful because it's meant that we can learn about some detailed medical problems, and we can learn about how much resource allocation do we need down that particular speciality. But the problem is that human bodies are a little bit more complicated than that. So what I want to pose to you today is it the way we're treating now, which is the body's just a bunch of soloists performing separate different pieces, and they don't talk to each other. It doesn't matter how if the liver soloist isn't performing very well, it's not going to affect the pancreas soloist. It's not going to matter. Or are we actually more like this? We're actually working in symphony. We're working together, and actually only together we're either making a beautiful music or throwing out some sort of discordant notes and beginning to show symptoms. What do we understand about chronic illnesses and what happens? If you take something like obesity, when you have, say, a set of 10 people that are diagnosed with obesity, they're not going to have all of these factors at play in their body. They may have a combination, they may only have one that led them down that path to have that diagnosis. Conversely, if we take one imbalance, one thing going wrong in the body, such as inflammation. Now, inflammation, just to explain to you, if maybe you don't remember from school, is imagine when you get a splinter and your body begins to go red, you get sort of sore and a bit of swelling. That's a normal response to that injury, and that's appropriate. Your body's trying to defend against any bugs that might have been on that bit of wood, and it's trying to expel that foreign body. So you go to exercise and you get achy muscles afterwards. That's normal inflammation. You've damaged some of your muscle fibers, they're being repaired, and you're going to come back after that strong and healed. What happens and goes wrong is when we have these injuries going on all the time and we don't have the capacity or the ability to heal from them. So someone used the same example, over-exercising. They never let themselves have time for recovery. Or you have inflammation going on in the gut, it's a lot less visible, but if you imagine that splinter analogy, you're getting injuries all the time, but your body is beginning to not be able to resolve the inflammation and go back to a state of calm. So when you have a state of chronic inflammation in the body, we now know from research it can lead to a number of different conditions. And, it's important to know that, there is things that can be done. Let me just see. Where's this? Okay. So functional medicine looks at things a little bit different, based around those core dysfunctions, what's going on. Rather than just focusing on your symptoms, we like to look upstream, and look at how and why that illness or those set of symptoms have occurred. And it's very individualized. As I said, in those group of people with a diagnosis of obesity, they're not all going to have those same imbalances at play. How do we do that? We use all our knowledge of biology, genetics, epigenetics to look at the factors. So I don't know, again, if genetics and epigenetics is a strange term that maybe not have explained to you, but for anyone in the audience who isn't sure, genetics is your DNA. So these are the instructions, in effect, that you received from your mom and your dad in every cell of your body, and they received from their parents. Now, up until a few decades or a decade ago, we believed that your DNA was written in stone, that whatever genes were there, they were going to be inactivated, and you were going to develop whatever risks those genes were associated with. And so it kind of made that we had a good few years where people were like, what's the point? I've got bad genes. There's just nothing I can do. And unfortunately, it really made a lot of people feel very helpless about their role in their health. Then came the field of epigenetics. That's where we realized, based on what we expose ourselves to, that is what tells our body which instructions to follow, which ones to ignore. So all the time, there's this discussion between our environment and our genes. So genes are being switched off and on based on what we're exposed to. And it gives us a lot more sense of control, I believe, for what we can do for ourselves and our health. Core to the practice of functional medicine is that you are the center of this. This isn't about the fact that I've got 5 minutes, just get to the point because I've got the next guy outside. This is about you, and we need to understand your whole health journey, even from preconception. Was your mother in an abusive setting? Did the pregnancy take place where she was under duress? Were you exposed to more stress hormones in the womb than someone who was in a normal, calm household? Through to where you are now and all of the conditions that you're struggling with, the symptoms that you're struggling with. So we think about all of that. It's difficult to do that as, in a GP surgery. They don't have time, and this is something where we realize we need to give it time to be able to do someone justice and to really unpack what might be going on. So this is the rest of the tree. I don't want you to worry about the details. But in essence, this is where we're working at the moment. A lot of the treatments, if I use inflammation as an example, inflammation, the other way to think about it is almost as if your body's a home and someone said, there's something bad going on, I need to call for help. So they go out to the flagpole and they put up the flag to the top of the flagpole. A lot of times our current treatment regimes really just involve suppressing that signal. So someone goes along and saws the flagpole off and off it goes. Is there inflammation still going on inside of that household? Yes, but what you've done is you've suppressed the actual signal. The signal, yes, it's causing you, that headache or that achy joint. But the problem is did you actually find out what caused that fire, what caused that inflammation to begin? So that's where we're working at the moment with medicine, really. And this is what actually underlies the symptoms. And this is all of the lifestyle interventions, the roots of the tree that are feeding up. So just in essence, this is what you feel. This is where I work to figure out what's happening. And this is where we go forward when we plan an intervention with functional medicine. So what we're going to do is we're actually going to go through these roots and we're going to think about them in as much detail as we can in the time. And I don't want you to be worried too much about some of the detail of the slides, but I wanted to be able to show you maybe the latest research about some of these lifestyle factors. And we can take questions at the end if there's anything that really is burning and you want to talk about. So if we go straight into sleep. I love this picture. This poor woman is reading a book, if you can't see, called How to Sleep Well. And I really feel for her. Sleep is, again, a massively underestimated lifestyle factor. So we know in 50% of the population, someone's experiencing insomnia. And that goes up to 70% when people are going to the GP. And that's not for sleep issues, they're just at the GP for another reason. What do we know about children and issues around breathing? Well, we know that it can trigger behavioral difficulties. So when sleep disordered breathing is present in 4-year-olds, 40% of them have behavioral difficulties. And in the 7-year-olds, 60% of them have behavioral difficulties. Inflammation is often known to be triggered by poor sleep. And we know it's linked to many other chronic health conditions. I had to put technology because I think technology has permanently changed the landscape of how we handle sleep, the way our bodies go through its normal hormonal cascades. When you are exposed to blue light, it tells melatonin, your sleep hormone, not to be secreted. So you inhibit your body's ability to begin the trigger. It's bedtime, I need to start winding down. You're telling your brain, it's daytime. I'm sort of bombarding my brain with this light that says it's actually still daytime, stay awake. So technology really has altered it in ways that we actually are only just now beginning to understand. This is a little picture from a research study, and again, I don't want you to worry about the detail, but I wanted to include it to show you, why is sleep important? Is it just something that happens from the neck up? Well, no. In much the way when you needed to study, you had to have a sleep to let that information soak in. A lot of the processes that are going on in your body, they need sleep to solidify. The memories of what your body was exposed to need time to be stored as antibodies. That happens during sleep. And when you lose sleep, as many of you will know, you often will come down with a cold or something after that lack of sleep. And that's because of this mechanism where you've lost the body's ability to restore itself, to remember its encounters from pathogens, and to build up its ability to defend yourself the next day. What do we know about what's normal for sleep? I put this young lady, who can spot what's going on with this young lady that I might be concerned about? Mouth breathing. This is there's so much ignorance out there, unfortunately, around mouth breathing that I imagine maybe if a lot of you went to tell your doctor or your dentist, my child mouth breathes, this is a problem, they might not know that it is. It is not normal to sleep with your mouth open if you don't have a cold. You need your mouth to be closed because your body secretes chemicals called nitrous oxide, and it helps your blood vessels to relax, to get good oxygenation. And it's a sign that there may be obstruction going on during the sleep. So if you're noticing your child's mouth breathing, I'm sure you're all going to go home tonight and peek in and just make sure they're not hanging. And also they might do it while they're playing, watching TV or video. And just say, close your mouth, can you breathe through your mouth? Just encourage them and just see if they find it difficult. Because if not, that's something to take to the GP because there may be an issue going on. And I say that after all the stuff I said before because often if there's sleep issues, particularly in children, because I know a lot of you are here because you have contact with star jumps and your child attends, a sleep study is really the thing that they need to ask for. And that's the way that you can diagnose whether or not your child is having issues with breathing and sleep-disordered breathing. How long should someone sleep? Well, actually sleeping too much, over 8 hours per night, but adults, children need more sleep than that, can cause problems with inflammation, but so can having too little sleep. So there's that sweet spot, and it's individual to each person. You'll begin to understand what you need and how you feel restored. On days when you sleep in, you might not feel as good, and so you'll begin to know how much sleep you know is right for you. In terms of breathing during the night, you should have smooth, easy breathing if you're watching your child or your partner. No snoring, gasping, or gaps in your breath. And be able to sleep in a normal position. Often people say, isn't it funny, look at my little sweetheart, she's sleeping sat up. And, that is not normal. The child has elevated themselves because they're not getting enough oxygen in that lying down position. And that's something which needs to be raised. So if you notice any of these problems, take a video. Okay. These are just some very simple tips, which I think, hopefully, some of these you've realized, but maybe something like exercising regularly you might not have thought about. Finish eating 2 to 3 hours before bedtime. Sorry, everybody, I'm one of them. I like to have a snack in front of the TV. It's not good because your body is sending blood to your stomach to try and digest that food. And again, you're not getting your blood sugar going down nicely and triggering going into sleep and rest. A couple other things that you might not have thought about is actually, again, I mentioned the blue light. Cutting off exposure to screens or blue light at least 2 to 3 hours before bedtime is really important. And I know it's very hard, and I put my hand up myself. I have a screen addiction. And it is actually one of the hardest things, I've stopped eating particular foods, I've managed that, but cutting back on phone time is very challenging, and I think it's going to be an area that, as a society, we really need to focus more on. How about bedtime in terms of your room? You'd want no lights at all. So you want no lights coming off your alarm clock, no lights from your plugs, charging your phones, anything like that. You want no exposure to any light during the night, because even a small amount can trigger your brain that it's time to wake up, even through your eyelids. Okay, so if you want more information, you can go to the National Sleep Foundation. They've got some lovely tips on that site. So we're going to move to exercise and movement. Exercise is interesting because we now, actually I want to present it to you guys not as something Jane Fonda-esque, but as a powerful medicine, actually, in terms of the profound effects it has on different parts of your body. If we look at the brain, it allows your brain to release a chemical called BDNF that increases its connections. It increases your brain volume. It can increase your actual gut bugs, or good gut bugs, and cause a more diverse community in your gut. And it can increase your body's ability to respond when you eat carbohydrates. All of these conditions we now know are favourably linked to exercise or lack of exercise. So again, here's a little snapshot from a recent clinical paper, and where we know, I don't want you to worry about the names of things, but what I want to show you is that actually when you exercise, your body releases these compounds that fly around and have an effect distant from your muscle. It isn't just about building up your muscle. They know this from a kind of funny study that they did. It wasn't funny for the mouse. The mouse exercised on the wheel, and then they get a little blood sample from that exercising mouse, and they gave it to a couch potato mouse. And that mouse demonstrated all the benefits as if it had exercised. So we can see now that actually it's beyond just the effect on the muscle. And if it was a medication, we'd all be taking it. So what are my recommendations when we think about exercising? Do we just try to push it into our current regime or what we're doing already? My husband had a real big laugh at this man on the hamster wheel. No, because if you just try to make it another thing on your to-do list, I think you're going to cause yourself more stress. Introducing exercise needs to be something that's done where you allow yourself a little bit of separate time away. Something like this scene. Okay, we might not all be able to achieve, we might go down to Bedford to have a walk, but can you go around the block for 5 minutes? Can you start to introduce small incremental changes where you move a bit more? It's different for every family. Here's my poor son. I made him for the first time this summer mow the grass. And he put up a bit of a fuss, but actually felt like a quite big boy. Getting kids moving can be done in creative ways. We don't need to just say, go up and run up and down, for the next 60 minutes. And I'll tick that box that I did my job as a parent. Doing things with them together is so valuable because we are demonstrating to them the importance of just putting your phone down and actually going and moving and doing a bit of something separate from your phone and from your work. When we think about maybe some of the things we can do with kids, it can just be any combination of these activities to make things up to 60 minutes at least per day. And I know a lot of kids don't have problems with this, but other kids, maybe you're going to have to get a bit more creative. And you can include things like your school run, the walk, make it a little bit longer, see if you can increase that time every day just a little bit more. Dancing. I don't know many kids that don't like to have a dance or watch you laugh at mom and dad doing bad dancing. So just a few ideas there to try and get a bit more active. So I'm going to hand over now to Abir, who's going to cover a bit about nutrition and the influence nutrition has. I'm concentrating particularly on children, and I'll just loop back and sort of summarize at the end. Okay.
Okay, so Liz has covered so much about what functional medicine encompasses, and I'm just going to talk to you briefly about the dietary elements, which are really important. And a number of you here will have noticed the differences that are a specific diet or even the diet in general has on your child. And so it's clear from the research and also from the work that I've been doing with children that nutrient deficiencies, food sensitivities and intolerances are common in children with autism, ADHD and other conditions relating to the brain. And there's various pieces of research that I've got references at the end that you can check out that is worth looking at, because I think that it's something that's often overlooked, and Starjump doesn't overlook it, and we're noticing it more and more in the research, and there's been a lot of anecdotal evidence as well from parents, but the more medical research we have around this, the better. And the reason that these nutrient deficiencies might occur is partly because of poor diet in some cases, because of picky eating, so very restricted diets would cause nutrient deficiency. Malabsorption of nutrients, which is when the nutrients are not properly absorbed by the body, and that might be to do with poor digestion or a compromised gut barrier function, which I'll talk a little bit about later. Imbalanced gut flora, so it's talking about those bugs in the gut that might not be optimal in terms of the ecosystem, and inflammation, which Liz also alluded to. And all those things can mean that you don't actually absorb the food properly and lead to nutrient deficiency. And those nutrients, all the micronutrients, the minerals and the vitamins, plant nutrients, if they're not properly absorbed, then it's very difficult for the body and the mind to function fully. So that is why special diets are often required and needed to avoid foods that trigger the immune system. And when you consider that 80% of the immune system is in the gut, it really makes you realise how important it is to not trigger the immune system in a particular way in the gut. And we know from research as well, not just related to autism and ADHD, but just general research, that localised inflammation in the gut can trigger something called inflammasome, which can lead to systemic inflammation. So that's inflammation in the rest of the body, including in the brain. And the brain and the gut are so intimately linked. They're actually connected by something called the vagus nerve, which I'm sure some of you have heard about. And so something that happens in the brain can really deeply affect the gut. In fact, they think that there's more neurons in the gut than there are in the central nervous system. So that goes to show how intimately and importantly connected the gut and the brain are. And I think something to mention here is that when there is inflammation in the gut, it can lead to physiological effects, which are sometimes felt in the gut. So bloating, diarrhea, constipation, pain, all those sorts of things. But there can be psychological effects as well, like brain fog, like inability to concentrate. And that's harder to convince someone that it's a gut connection, because if it's felt in the gut, then it's obvious. But if it's not felt in the gut, then sometimes it's harder for people to realise that it's potentially coming from the food that the child is eating or maybe not getting or absorbing. And so therefore trying to heal the gut and the brain without avoiding trigger foods can slow the healing process. So there are very common special diets out there, and some of you may have tried these. The most popular one is the gluten-free and the casein-free diet, so casein being the protein in dairy, and that is the most common food. Those two particular agents in food, rather, can create something called morphines in the body, or casomorphine, gluteomorphines, which act like morphine. So some children have an awful lot of brain fog, and I've had situations, and it doesn't happen in every case, but several cases where we've removed gluten and casein, and within 2 weeks the child's brain fog has lifted and they've been able to read a book, whereas previously they were struggling to sit down for 5 minutes. Now those are the amazing cases where it's obvious that it makes a difference. In other cases it can take a bit longer to feel the effects, and in other cases still it might not be gluten or casein that's the problem. Soy can also have a similar effect. But anyway, that is one of the most popular special diets to follow. There are other diets called low salicylate. Have you heard of that diet? Yeah, so it's about food additives, but then certain foods also contain products or agents that act like food additives that you would get in sweets and things like that. Low oxalate diet, there's more and more research coming out about oxalates actually, and they're actually a byproduct of metabolism that can be picked up in urine. And there are certain oxalate foods which are very good foods, like spinach and things like that, and they are quite high in oxalates. And so if your child suffers from pain and a dysbiotic gut, then sometimes it's worth looking at the oxalate foods. there are other diets called the specific carbohydrate diet and the GAPS diet, which had quite a lot of media attention with a book. Have you heard of the GAPS diet? Okay, so it can be quite useful to heal the gut with some of these diets, but they are quite overwhelming and there's a lot of them. And so that brings me to the importance of personalisation. And I was reading an article the other day that has recently been published by the Journal of the American College of Nutrition. And what they say about personalised nutrition, I'll just read it, is that personalised nutrition is rooted in the concept that one size does not fit all, which is exactly what Liz was saying. Differences in biochemistry, metabolism, genetics, and microbiota, which are the bugs in your gut, contribute to the dramatic inter-individual differences observed in response to nutrition, nutrition status, dietary patterns, timing of eating, and environmental exposures. And I know that sounds like a lot, but basically it means that we are all individual, we all have our own genetic predispositions, and it is important to consider that when you're in a consultation, either with a functional medicine doctor or with a nutritionist like myself, in order to implement the right diet for your child. And I think that's where you can perhaps not be overwhelmed, because we always work with the individual and also with what the parent can actually do. And so sometimes it's small steps and other times it's bigger steps, depending on what you feel you're able to do for your child. And so just coming to the gut-brain connection, I wanted to just read you the title of a really interesting paper that I think it's worth looking at, and it's called The Microbiome, a Key Regulator of Stress and Neuroinflammation. And the conclusions were, and it's so small I can barely read it, is that the evidence presented herein suggests that resilience to stress and immune-related disorders and dysfunction of stress and immune systems may be dependent on the diversity and complexity of gastrointestinal microbiota. And there is more and more research coming out now about the influence of gut health on the brain and brain functioning. So it's worth looking at that paper, and I'll put the references up at the end and you can write it down perhaps if you're interested to read more. And so, as it shows here and in other studies, that toxicity in the gut can affect the brain. Studies have shown that a prevalence of leaky gut, which is when the gut barrier function, which I'll talk a little bit about later, is not, has lost its integrity. Low levels of beneficial bacteria, inflammation, and immune reactions to food are common in children with ASD. And one research paper indicated that unrecognised GI disorders, meaning that the child had gut dysfunction but not necessarily particularly specific ones that related to an inflammatory disease, let's say, may contribute to behavioural problems in non-verbal autistic patients. So there is research building around this area. There's not enough yet, and there's more anecdotal evidence than there is researched evidence, but it is growing, which is a good thing.
Could I just ask you a quick question?
Yes.
What are immune reactions in children with ASD? What's that mean?
You mean immune reactions to food?
Yeah.
Yeah, when they would have a reaction to a particular food. So sometimes, sometimes it would be felt in the gut. So you would notice that they would have diarrhea, or they would have constipation or pain. Those are the more obvious things. Other immune reactions might present themselves in a more psychological fashion, like the ones I mentioned. Now, this is all just from observation. There are tests that you can do that are will actually tell you if your child is creating antibodies against specific foods. And they are quite interesting tests, and I do use those because especially in a child that isn't necessarily suffering from gastrointestinal symptoms, and the parent would like to know for sure whether they are having that reaction, there are some quite sensitive tests out there to show whether they're producing antibodies against that, which would mean that it's creating potentially a level of inflammation in the body. Yeah. Okay. So this is the paper that I just read the summary of. So I just want to finish off by talking about the approach that a nutritional therapist generally takes to try and address the diet and absorption of foods, and it's called the 4R approach. Have any of you heard of it? Yes, okay. So the first R is to remove any offending foods, chemicals and other toxins that might inflame or pose an obstacle to optimal nutrient absorption in the gut. And so this is where the elimination diets come in. And so that would be when we would discuss, potentially you might have tried some elimination diets. Have many of you tried elimination diets? Yeah, okay. And I know that, some people it's successful, and with others it's been a bit hit and miss. In fact, you know, some of these elimination diets can be quite dramatic, like I said. Others take a little bit more time. And sometimes parents will say that they really, really can't do this because their child is so fussy that they really can't remove those foods, and therefore we negotiate how to optimise the diet and then potentially at a later date come back to the removal of some of these foods. So the one that I would typically start with would be the gluten-free and the casein-free diet, because that one seems to have the most dramatic effect, but not in every case. So it is important to consider that though, because if you don't remove those offending foods, or potentially offending foods, then it's quite difficult to get that level of healing that you might have otherwise. So the second R is to replace what's missing in the gut and the body by increasing specific nutrients through a diet that consists of nutrient-dense foods. So if, for example, as a family or as a parent, you felt that it would be just too difficult to remove certain foods that the child happened to love, and you knew that the child was not thriving, then we might just go to this second point first and start to optimise the diet, because sometimes the diet is so poor, not because of the parent, because the child doesn't want to eat certain foods, that we would just look about how to just give them a nourishing diet. I mean, we all need to have a nourishing diet. We could all do more, we're all so busy, rarely enough time to prepare really good food, and so we would just be looking at literally having as good a diet as possible and discussing that with schools to make sure that they're doing their best as well. And potentially also supplementing with vitamins and minerals. And in these cases, I really recommend having tests at the GP to test iron levels, to test what vitamin B12 levels and folic acid levels are, just so you know on a piece of paper what's happening in the body. And so it might be worth supplementing with vitamins and minerals. And I actually do find that of all the supplements that I will use, vitamins and minerals tend to be high on the list, and probiotics, obviously. Nutritionist. But so I think that's important to replace. So the third R is to re-inoculate, and I talked very briefly about the gut connection, but since the research shows that children who have ASD and other learning and developmental challenges tend to have a disrupted gut flora, it's worthwhile kind of re-inoculating the gut with probiotics, which are the friendly bacteria. Now there are trillions of microbes in our gut. In fact, their genetic material outweighs our own genetic material, which is a frightening thought. And so you could ask, which one, which probiotic.
There's Simproof. Is that a good one?
That's wonderful.
I give my son Simproof every day.
Do you?
I just wondered if that was.
Do you find it useful?
I think it's definitely improved the quality of his stools. Yes.
Brilliant.
Yeah.
There's been a lot of research on Simproof, and actually doctors do recommend it.
Doctors say they recommend it.
Yeah, oh good, yeah, good. Yeah, no, and actually doctors do recommend it, which is great actually. And it's had the most research on it in IBS, and so I find it particularly useful for IBS. But there is a strain of probiotic in there that's known to support the immune system and the gut, so yes, that's a good one.
Celiac disease.
Right, so that was right.
And
Okay.
has iron deficiency anemia.
Mm-hmm.
And I'm going to get his blood done for his vit D as well.
Good for you. That's great.
So if I just wondered if Simproof was the best one, because again, like you said, there's so many different ones.
I think it is a really good one, particularly for certain things. I use other strains as well, depending on what's going on. I mean, there are some more sophisticated products out there that will give you. I mean, apparently there are 4 keystone strains of bacteria in the gut, and they come from like 4 different families. And so now there's a new level of products that will give you. It's the spores for the bacteria, so it's not the actual bacteria, and then it encourages the growth of those 4 keystone strains. And we know from various studies that if those 4 keystone strains are healthy, then generally you'll have a fairly what's called resilient gut, because that's what you want in the end. And so yes, I do think Simproof is good. I sometimes rotate probiotics though in order to give a variety.
It's a meal replacement. What does that mean?
A meal replacement? Do they really?
Yeah.
I don't know. I've never seen it described like that.
A meal replacement.
Well,
It probably allows them to avoid calling it a drug or treatment.
Oh, possibly. Yeah.
So it's a meal.
Yeah. A meal for your gut. Yeah.
So I thought that was really interesting.
No, that's interesting.
Okay.
So that's that. So then there's prebiotics. So prebiotics are what you would call the food for the good bacteria. And so what's really important to note is that if you have poor gut function, and we'll come on to that in the last R, then it's all very well giving probiotics, but if you don't create the right environment in the gut to thrive, then as soon as you stop the probiotics, then it might well go back to how it was before. Not maybe as bad, but it might, and particularly if you haven't changed the diet. And so prebiotics are actually found in soluble fibres. There are ones that are very specific, like artichoke, but really how many people eat artichoke every day? And other vegetables, onions, garlic, oats. There are a number of foods that provide the food for the good bacteria to thrive. So it's important to get that through your diet in order to make sure that if you were to stop the probiotics, that your body would be able to do it by itself, which is essentially what you want the body to do. And then finally, the last R is to repair. And so if you have a level of malabsorption, the chances are that you have had some damage to the gut lining. When there's damage to the gut lining, which you would find in celiac disease, generally there's a level of dysbiosis, which means imbalanced gut flora, and then localized inflammation in the gut. And you can repair the gut in a number of different ways. It can take time. You do need to think about avoiding some of those trigger foods so you don't have that constant thorn in your side. There are also specific supplements that you can use for that, and also foods. Chicken broth, I mean, I know that's got quite fancy, famous now, but that was a typical thing that people would use. I'm not saying that on its own, but there are certain foods that you can use to help to heal the gut, even liver, which is high in vitamin A, and then some carefully selected supplements that would be useful for doing that. But more importantly than all that is to make sure that the diet is optimised and that the child is having a variety, particularly of vegetables every day, because vegetables are really what are needed for the gut to thrive. So that is the 4R programme, and essentially it links to what should your child be avoiding and what should your child be including in order to optimise the gut.
I was just going to ask, so if your child, so my son, he eats a few vegetables but not a wide variety, should you, if you can't get a wide variety, should you supplement with vitamins?
Yeah, I mean, is there a chance that you could increase the variety by offering, or is it difficult?
Sometimes difficult, but
Yeah.
he likes broccoli.
Yeah.
So
It's about different colours. I mean, different colours are important. There's research to show that each colour of the rainbow affects a different functionality in the body, actually, when it comes to vegetables and fruit. Potentially, yes. Potentially, yeah. I think actually most children who have ASD or ADHD need a vitamin and mineral supplement as an insurance, and partly just because our soils are not as good quality as they used to be, and so it's quite difficult to get all the vitamins and minerals that we need just by eating. Well, if you had a brilliant diet, maybe, but if you have a restricted diet, then yes. Yeah.
Sorry to interject again, but the minerals and vitamins that are available, I guess this is where you come in, from regular shops. If you look at them, the percentage of what is actually included, the vitamin or the mineral that you're trying to include, is in many of them tiny. So it really does, you're almost spending money on a capsule which contains more capsule than supplement. So how do we, without regularly coming however many miles to see a nutritionist, find out which ones are viable?
Well, we can send you some information. I'll send you some information about that if you want. I mean, quality does matter, and actually there's a lot of synthetic vitamins and minerals out there that are not very well absorbed by the body. So there's a move now.
Doesn't say on it it's oil soluble or water soluble.
No, so food-grown nutrients are a newer thing. So something that's been food-grown mimics what happens naturally. So that's much more bioavailable in the body. So I would look for labels that say that. Some of the liquids. Well, I do know one that I use particularly that I think is quite good by Biotics Research. It's called Aqueous Multi. You can find it probably on Amazon or otherwise through a practitioner site. But something that's food grown, something that is more bioavailable would be something to look at. And Wild Nutrition are quite a good company. They're capsules though. I'm not sure if they do Wild Nutrition. They do food grown nutrients, but there are others as well. Like I can't remember off the top of my head.
No, thank you.
But yeah, that's what I would be looking for. Yeah.
So things like Happy Deck and Dalavit, they're all They're a bit of a con.
Well, it's not. Well, no, they'd be doing something. I have read research that they do something. It's just about how much when you really need it a lot. Particularly if you really need it, then you need good quality.
Yeah.
Yes.
Okay.
Yeah.
If you're just getting someone over that point which they're not deficient,
Mm.
Abir might do it.
Yeah.
But actually, are you getting to the person, because being well is not just the absence of symptoms, it's actually being healthy,
Yeah,
being
exactly.
able to do what you want to be able to do, play or learn. Yeah.
Good. Okay, I'll just skip through these slides. There's various bits of research here which, if you're interested in, we can send you these references if you want to read more. Okay, and then you better click on. So thank you.
So I just want to maybe what you eat and diet come into a functional medicine assessment and what I might prescribe to you in terms of a lifestyle intervention. So in functional medicine, we understand food to be more than just energy and more than just the vitamins in it. It actually is information. As Abir touched on, there's a constant interaction and discussion between your immune system and the foods you're providing it with. And also in between there is the bacteria and what it's doing in terms of breaking the food down and whether you're feeding the good bacteria or not. Food is also connection. Being able to sit down as a family and eat is incredibly important. Some of you are not able to do that because your child's needs mean that it's very difficult to do that. But being able to, on a regular basis, maybe sit down with your partner or your friend and connect over food is incredibly important, because eating in a calm state of mind allows you to absorb your nutrients better. It means that your body is not in a state of fight or flight thinking, I need to quickly get this food down and then go on to the next task. You're able to take on board the nutrients you're providing it with. And food is also medicine. So what Abir touched on a little bit, part of the healing process when you have something like damage to your gut is you're going to be providing the body with the foods it needs to repair that damage. And that actually, the damage might not just be in the gut, it might be in the brain, it might be in the rest of your body, say you have problems with your joints or you have rashes. Providing your body with, say, fish oil so that it can rebuild and calm inflammation wherever it's going on in the body. So food is important. And so after someone sees me for a functional medicine assessment, I would suggest they proceed to a number of different food plans. Diet is not in terms of like calorie restriction. It's in terms of a set of food, a list of food that you should aim to eat and foods that you should aim to avoid. After we collect information in terms of how does the person respond to that diet, what have we learned from that and the reintroductions of the foods, whether they caused problems or not, you then move on to a longer term personalized nutrition plan. And that is different for everyone. I think all of you hopefully will have realized maybe in your own journeys that, just because Martha's son responded well to that particular diet doesn't mean that yours, doesn't mean that your child might. So every child's individual, and that means that each person, each family member might end up with a slightly different set of foods that they are on for the longer term. And I just want to include this because I think it's important to think a little bit about why are we in this situation, particularly now. After, more than half the food bought in the UK households ultra-processed. So that's 50.7% in the UK, it's over 70% in the USA. Now, shelf-stable food was great post-war. We wanted food to last a long time, that's what they wanted. But unfortunately, food is now solely kind of produced with that in mind, that it should last a long time, that it looks good, that it holds its, doesn't break down. Actually, food should break down. That's actually what meant to happen. And, we need to start thinking about when we look at a supermarket, if you're spending the majority of the time in the center aisles on that shelf-stable food, you're going to be part of that percentage. Unfortunately, try and spend more time in the areas of food where the food needs to be eaten, because it's actually rich in nutrients for a short amount of time, because that's the food that your body can use as its most bioavailable. That means that we've evolved around these foods and our body knows what to do to incorporate them. Our body does not know what to do with some of the processed food ingredients that keep it shelf stable, and actually we now know some of those ingredients damage the gut.
Sorry, may I interject?
Yeah.
Sorry.
Yeah.
Frozen as opposed to fresh vegetables?
If you're on a tight budget,
No.
then,
Well.
if someone's saying, I can't afford to get a fresh vegetable, frozen's better. Yeah.
No, my question is more to do with which one has more nutrients because the fresh tends to either travel or you don't know when it was picked, whereas some of the packaging on frozen says this was picked and frozen within goodness, a nanosecond.
Yeah.
Do we believe that, or do we go fresh?
This debate goes on within, our communities all the time. If you're going to rank food, you're going to say organic, from your own garden, obviously. Then I think fresh is still ahead.
So fresh organic, if you can.
Yeah, and then fresh and non-organic. You can go online and look up the Dirty Dozen.
Yeah.
Many of you are nodding to that. Someone went and analyzed the pesticide content of lots of different foods and looked at, if you had to pick particular ones that you were going to buy organic, those are the ones that you want to do because they have, like berries, because the berry skin is very thin, they pull in a lot of those pesticides. So getting an organic berry is preferable than buying a non-organic berry because you know that non-organic berry is got a higher pesticide content. Something like an orange or a banana with a very thick rind, you can kind of say, okay, I'll save a bit of money and I'll buy a non-organic type because in theory, the pesticide content is lower. So you can look up the Environmental Working Group, have done this, they do it every year. They analyze the fruits and vegetables and they make the Dirty Dozen and the Clean 15 list. So you can look that up. But yes, that debate goes on really. And, each family is different. If hey, I can't go out and get it, but I know I can get a frozen spinach in them and put it in the food, then do that. We're about practicality and working with what you can do in that time and actually not about condemning people's sort of home situations and making them feel guilty that they've not lived up to this standard because I've been where you are. I have struggled and I am struggling to balance it all out, try to feed your children well, but also to, have, get them to school on time and do everything that needs to be done. So we understand the challenges that you all face, and we're here to help you and give you new ideas and kind of maybe turn things around a little bit. The other thing I really want to just quickly touch on with food is a phenomenon that happens in the brain. When you sit down to a meal you've never had before, the broadcast is stopping. I don't know if you want to. Something happens in the brain and you get a reward chemical eating this new meal. If you come to my house and I serve you the same meal again and again and again, you no longer get that reward chemical. Now there's certain foods where actually you do. Time after time after time, you get that buzz. Does anyone want to guess what that food is? Sugar. Now sugar, it is addictive. It is incredibly complex, and I could spend a whole talk just on sugar alone. You can get Robert Lustig's book. You can learn about sugar and actually how it's changed the food industry and our health. But it's important to understand that reward you get when you get a new meal, your sugar, it's never going to wear out. Someone's always going to want another chocolate bar. So bear that in mind when you try to think about presenting new and different foods to kids. You're also potentially giving them that little bit of excitement when it's something new and different. So, there's a complex interplay going on in your brain all the time around food. So, if we move on now to talk a little bit more, you touched on this a bit for me, Abir. I'm going to just kind of add a little bit more here and there. Again, this is a snapshot from a recent paper. I don't want you to worry about the names of these groups, but these are a sort of representation of what's going on all the time with the microorganisms that live in your gut. So it's not only bacteria, but it's also fungi and viruses. All the time, as you kind of imagine in a community, right? You've got people in the community who are your upright citizens. They contribute. They like to do things and give back. These are your symbionts. They're doing good. So they're doing things such as making vitamins from the food you provide. So they might make a vitamin K or a different type of molecule to feed your gut wall. Then you've got these guys. They just kind of hang out. They don't kind of cause problems either way. These are thought to be your commensals. All the time we're learning more about commensals, that many of them are now joining the good guys. And then these are these bad guys. They're okay if they're in balance. They cause inflammation by their presence, but it's kept in regulation by the good guys. So, there's this constant balance, and it's changing all the time, like hour to hour. What happens when things go wrong? So, who can guess maybe what happened in this person to make these good guys go down? They went to the GP and they got a course of antibiotics. And unfortunately, then it allowed these guys to take bigger foothold. And the balance is lost, and you get to a state where you have a kind of non-specific general inflammation that's going on in the gut. Unfortunately, sometimes these guys also can cause more problems, not only just in the gut, they can produce certain chemicals that go forward and actually hurt the liver. This was last year in The Guardian, talking about a potential epidemic of fatty liver disease in young people. These bad bacteria love sugar. And unfortunately, as they become more and more predominant in someone's gut, they produce more of these damaging chemicals that go to the liver and cause inflammation in the liver as well. Now, the reason why this is so dangerous is this can go on with no symptoms externally to the person, and it can then present quite late. And it's believed that fatty liver disease is actually going to become the most leading need for liver transplants in the very near future, beyond like damage from drinking. So we have to, I know it's a startling thing when I saw this, I really did gasp, but one thing we need to realize is actually this is reversible. When it's at this stage, changing someone's diet can reverse those changes in the liver, and that's been proven, that's well known. So it's good to know that actually when you make a change, you may not be able to see all the benefits that are at play. So what can you do? Again, to improve your gut garden, to improve your community and make it full of more upstanding citizens. These tips are from a great website. In terms of resources, you mentioned looking for good resources. Chris Kresser, I love. He's a gentleman who's does a lot of research. He goes through the latest research, and when he talks about things like, should I take a supplement or should I just eat good food, he's a good place to go and research if you have a certain health question. So this is taken from his lovely little list, talking about what you can do to improve your microbiome. Now the thing about your microbiome, actually in research and in the influence of probiotics, what we understand probiotics to behave as is they're almost like tourists visiting this town, your community. They come and they stay for about 2 weeks and then they move on. But what we know can permanently change your microbiome is changing your diet and exercising. Those two independently, even if you do one or other, can permanently alter your microbiome. So I think that it's incredibly exciting information that actually showed. I was a bit disheartened when they said probiotics didn't always take hold and move in. They were more like tourists. They're doing something. It's not that they're not doing anything. They're improving that balance. They're talking to your immune system and saying, calm down, it's okay. But they may not move into the community. But if you change the food you're eating, you can actually alter that permanent community that's living there all the time and cause the good guys to increase in population and some of the bad guys to have to move out of their house. Some of the things that we eat and drink, obviously you're not going to recommend a cup of tea or coffee to your child, but tea and coffee was really interesting in the research because they have some of these phytonutrients, some of the things that Abir was talking about, these chemicals that are present that increase the growth of good bacteria. And obvious things like avoiding the bad foods, because things like sugars and high fat, saturated fats, not good fats, but bad fats, these bad bacteria, the pathobionts, they eat that food preferentially, and then you basically cause them to increase in growth. Getting good sleep, again, has been shown to improve your microbiome into a good balance. Okay. So we're going to move on to talk. I've grouped these 3 lifestyle interventions together because I feel that there's a great overlap, and I think I can just cover it quite nicely together. But before we do that, do we have time to? Okay. So what I want to actually do first is just take you through just a minute of calming breathing. So can we just turn the light down? And just get you to put your pens down. And if you're at home, you can do this as well. And you uncross your legs and just put both your feet on the ground. And I want you to put one hand on your tummy, another hand just touching your leg. I want you to take in a deep breath through your nose over the count of 2. Just feel your tummy going out. And hold that breath over the count of 3. And then out through your mouth over the count of 4. Okay, and again. And once more. Okay. Okay. So we just come back in the room. Can we get the lights back again? A lot of this information is overwhelming, and I think it's important that you get a feel for what maybe part of the interventions for the next arms might involve. We spend a lot of our life in a state of fight or flight. We might not realize it, but we're hardwired to respond to threats. And we're not being chased by dinosaurs anymore. We're being chased by our inboxes or our child's ECP report, or needing to get to that appointment or this appointment, or caring for our parent, or caring for someone else in our life who's unwell. The effect of stress is profound on our health, and I think it's often not really understood when we talk about it in a kind of like, I'm so stressed out, but actually don't know where and how to change things. I want to talk a little bit about the science and what we understand about stress, and maybe what we can do to change things. So this is a snapshot, again, from a textbook. What is stress? Well, you know, your stress isn't going to be my stress, because it's so individual, what we experience as stressful. We bring all of our past experiences, our trauma, what we believe that stressor means for us. Does it mean that we will lose our job, or is actually, it's fine, it's something, this too shall pass. It's a very complex thing that actually it's very difficult to unpack what one person finds stressful and another person doesn't. We understand that it obviously has an effect on our bodily systems, because a stressor, something that's a threat to us, inactivates our adrenaline, because we need to be ready to run away from that stressor. But it's not a dinosaur. What if it's your inbox and it's not going, it's just in front of you all the time? Our stresses in this modern time aren't starting and stopping. It's just this perpetual cycle of each thing after another. We're constantly exposed to. And unless we take actually a close, hard look at it and allow ourselves moments where we remove ourselves from that constant onslaught and deliberately tell our mind, to tell our body we are safe through just simple things like that breathing that we did, your body switches into a different state, from sympathetic to parasympathetic, to a state where actually I'm safe, I'm okay. This is a real simple example. In theory, both of these people are in balance. They're basically putting as much demand as their body can handle. But what do we see here? This system is about to break down. At the moment, it feels like what we do in society is we keep loading more and more on our shoulders until the point at which we break, and then we sort of just go, I'll just take that last thing I added onto my plate away. It's a little bit more complex than that. Actually, we need to be much more sensitive in terms of what is our capacity, what can we handle. If right now you're dealing with a child that has chronic issues, no, I can't volunteer on the PTA. I'm sorry, I wish you all the best, but those extra things, which you may feel you should do, you don't have the capacity for, because your health regulates the health of your home. Being healthy as a parent means that everyone else can have a chance of being healthy. So protecting yourself and looking after yourself and not overloading your resources is really important. What do we understand about stress? Well, the stress itself actually technically is actually potentially good. So when I go to exercise, I'm stressing my body because I can put a demand on it, but I can meet that demand. What we're talking and what I'm hoping I'm getting across to you is the idea of, are you inappropriately stressing your system? Are you overdoing it? Because we know chronic elevated stress can cause what we call as oxidative damage, which is damage in your cells and your body. And it can actually affect your brain volume. So relationships and network. Again, this is something which, I think as a psychiatrist in my background, we suffer a lot from this sort of divide that, this is a head problem and this is a body problem. That isn't at all what's actually going on within your body. There is the constant crosstalk within your body systems between what you're experiencing and how you're experiencing it, and inflammation in your body, and whether you feel safe. If you have a state of inflammation in your body, you're going to struggle to connect with others. You're going to be more likely to perceive things as rejection, and it's going to cause you to be more isolated. Conversely, it can make you increasingly, feeling, sensitive to what others are saying, and you can struggle to find that connection. When you find that connection, the opposite happens, and you can improve inflammation in your body. So, trying to think a little bit about, I know that maybe all of you parents here might have a lot on your minds, and your evenings are filled with doing research and figuring out what are we going to do next, what school are they going to go to next. But make time to connect with others. Make time to prioritize fun and connection, and you won't regret it because you will be feeding your body, not only your mind. And I also need to sort of introduce the idea that trauma, we know now from research, can alter your brain volume. It can change your inflammation in your body. And we know that from things like soldiers coming back from war. But we also know that from children who experience adverse childhood events. And that's a number of different things. What coping mechanisms did each of us get to deal with the trauma that we encountered? Some of us got great coping mechanisms from our parents. Others got nothing, or actually unhealthy ones. Think a little bit about whether the trauma you've experienced, you feel you've integrated, or whether it's still affecting your daily life and causing you worry and concern, and probably infecting the state of inflammation in your body and your ability to make good choices in the here and now. So I wouldn't be a very good psychiatrist if I didn't include the importance of psychological therapies. For some of the people who are going to come to see me at Star Jumps, I'm going to suggest that this might be helpful to improving your health, your family's health, and your resilience. Because not everyone benefited from, the perfect home. Actually, I can tell you, of all the patients I've seen, they've never met a perfect family. We're all dysfunctional. And we're just fearing how good we are at hiding it. So and the ones I really worry about, I had a great childhood, I don't know what you're talking about. Then I'm like, that's when you really have to worry. We're all broken, we're all bringing our wounds and doing our best for our kids, but we will, make mistakes. And as a family, as you journey through what each one of you's dealt, being able to seek help and get support externally to help your family function is so important and shouldn't be a thing that's of shame or embarrassment, because I've found it to be just incredibly helpful. Outside of psychological therapies, I wanted to include a few things which I would encourage you to think about whether or not it's for you. Some people pursue a faith. Other people, as a part of that, but also just separately, the practice of gratitude and its science behind it has been exploding. We know that gratitude itself reduces stress and the stress hormones. It makes people healthier. They have reduced rates of chronic ill health. And I had encouragement maybe. Maybe you're not a family who says grace, but maybe you can be a family during the meal where you go around and you talk about something that you're grateful for, someone that helped you today and someone that you helped. If you could start building in little habits of gratitude, you can actually attach them to current habits you already have. You can become a family that's more reflective, family that's more resilient to what you're facing, and start reaping some of those benefits in your health as well. As I said, being able to be having gratitude and some of the other things we mentioned before can help you find meanings to the struggles that you have in your life, and it can help you to integrate some of the traumatic experiences you face. So, I don't know how we're doing for time.
We're running
Running
we're at
over?
8:45, just running.
Okay. So I'll very quickly run through the final route. As we've gone through, I hope you've seen that some of these routes actually influence each other. So the exercising influences microbiome, and when we talk about sleep is improved by exercise. So these things are not standalone interventions. If you try maybe to do one or two small things to improve your family's health, you have knock-on benefits in the other routes. I always like to help people to be realistic when they set their goals, because there's nothing sadder than people sort of saying, like that New Year's resolution, I'm going to do these 20 things, and then they feel a terrible failure because you can only keep things up for, 1 to 2 weeks with willpower alone. That's why we need each other, we need support, we need to attach new habits onto existing ones to be able to make changes. Environment pollutants itself, it's a big topic. It's basically everything you're exposed to externally and internally. Now, all the time we're exposed to a lot of these things. The question is not so much whether or not, we need to panic. It's actually what environment you're exposed to, and actually is it promoting your health, or is it probably sending you down a path of ill health? If some people often come to me and say, I'm getting migraines, and then you start talking to them, well, can you walk past the perfume department without, no, actually, I can't go through Lush, it's just too much. The smell of petrol now just makes me nauseous. These are all warning signs that someone's body has begun to tip into the point at which it can't clear some of these particular compounds out of the body. If you're smelling something, it has been absorbed into your body. Your body then needs to deal with that chemical. Generally, our bodies have been amazingly well. But if you imagine how we've evolved, so many things have been now introduced into human consumption and absorption that were new chemicals, new compounds, that our body has not adapted to know how to deal with. What you eat and drink also can affect it. So nutrition, we know from research, is either a helper or a hinderer of the impact of what you're exposed to in the environment. So it's all the time there's an influence on your body. So this is a big topic, and it's difficult to do it justice, but I did want to include it because I think there's a lot of people who do have environmental exposures that are important to their health. Little kind of tip slide, because inflammation's been mentioned a lot. These are the top tips for working on improving your inflammation if you're going to try and do something at home. A lot of them cover the branches we've already mentioned. Inflammation is probably the big one we talk about a lot, but there are other systems within your body that can go awry. That's where you rely on me to help you navigate that, and we analyze based on your symptoms and your health story what potentially is going awry. But inflammation comes up extremely commonly, a lot of people's stories. Again, you mentioned the rainbow beer. Trying to eat the rainbow means that you're picking up a lot of the phytonutrients. So the compounds that make those different colors are actually all active within your body, and some of them speak directly to your DNA. They attach and tell your DNA to do different things. So just trying to follow that simple tip of trying to eat a rainbow, that's really kid-friendly. A lot of kids like that, and actually you can make a rainbow chart to stick on the fridge, and they can tick through the week or through the day. Have they eaten their orange today? Have they eaten their yellow today? It's difficult in winter, I understand. But these kind of tips can be helpful. And just to touch on that, recently functional medicine had a positive publication in the Journal of American Medicine. They took 2 groups of people, one attending the functional medicine clinic at the Cleveland Clinic, and overall, after 6 months, they were doing better. So I think it's really positive to think that it takes time, but actually you can make potentially lifelong changes for yourself and your family through this approach, going in at the roots and changing the chances of you developing or the course of longer term illness. I've covered a lot today. I'm sorry if your heads are spinning, but I want to, I suppose, encourage you, because I've gone through this journey with my brother. I've gone through, and I actually still deal with these kind of these people that should be retired telling me that Down syndrome can't be changed. It's just all, you know, set in stone, and I have to educate, you know, them kindly and nicely. There's potential. We all have huge potential, and that there is something that each one of you can do, even if it's a small change. I don't want you to feel overwhelmed. I want you to feel the potential that you have to steer the course of not only your own health, but your family's health. I've flown through the tree and the roots, and I thank you so much for your attention. And I suppose we can open to the floor for a few questions.
To turn off the